I'm Dr. Eppley, plastic surgeon of Indianapolis, and I want to spend a few minutes with you talking about, are you ready for plastic surgery, or is plastic surgery right for you? Every single day that I see patients, I hear the common question of, do you think I need plastic surgery? Whether you need plastic surgery is really determined by you. The question is the concerns you have about whatever face or body part, would that be benefited by plastic surgery? Most likely, if you think you need it, then it probably is true. That is a question that I, as a plastic surgeon, cannot really answer about whether you really need it. However, I can help you think about, are you ready for plastic surgery, by covering a couple basic issues that you really need to think about. First and foremost, do your homework on the plastic surgery procedure that you have in mind. The internet is an excellent source of information. While it is true that a lot of the information is inaccurate, and some of it is even, quite frankly, misleading, nonetheless, there is a ton of information in plastic surgery across the United States and around the world. Do your homework, read it, digest it, and most importantly, come in with some questions to ask your plastic surgeon. If you do your homework, you will have a much better consultation time with your plastic surgeon. Plastic surgeons do this all day long. You likely will only have one surgery. We don't want to miss the questions that are most relevant to you. So if you do your research and bring in some good, pointed questions, you are going to get some really good answers. Secondly, make sure you can afford the procedure. Now, that may seem like a strange question coming from a plastic surgeon, but I think it's an important one. I certainly cannot tell you whether you can afford it or not. Only you know your finances, and only you know where the spending of that money sits on your priority of life. However, always factor into any procedure some additional cost. There may be extra time off work that you didn't count on. There may be some additional cost if you have to have some secondary revisional surgery. So what I can tell you about your finances is, make sure you have a little buffer in your finances so that you can afford the procedure if there should be more cost than that which you pay up front. Thirdly, be aware of that there is a real risk of complications in elective plastic surgery. Complications are not rare, and they do happen. While most complications are relatively minor and are just a short bump on the road to an excellent result, some complications require more time off work, and they certainly require more psychological support and usually take longer to get to a good result than you might have anticipated. So you must factor that into your equation. And as I previously mentioned, make sure you have a little extra money or finances set aside so that should you have complications, it still fits within your budget to get it adequately treated. I think if you look at these three issues of doing your homework, make sure you can afford it, and be prepared for complications, I think if all those are in order, then you are really indeed ready for plastic surgery. I'm Dr. Eppley, plastic surgeon of Indianapolis, and I wish you the best in your plastic surgery experience.